City Pulse is sponsored by CN Vision Image Consulting, Chi, an international focus magazine. Music provided by Houston's own Dynamic Sound. HTV supports local businesses.
Hi, I'm Chanel Thomas.
And I'm Ted Irving. You're watching City Pulse, a show for the City of Houston by the City of Houston, featuring stories about council leaders and their districts, city departments, and sponsored attractions around town.
On today's episode, we show how reading promotes positivity and a fifth ward program is giving minors a second chance.
All right, but first, e-cigarettes are dangerous and 3 teens have been hospitalized due to lung illnesses. Joining me to talk about the rising concern is Dr. David Persse, the Public Health Authority for the City of Houston and Professor of Emergency Medicine and Surgery. Welcome to the show.
Thank you for having me.
So let's talk about vaping. We have the illnesses and we're talking about young people. What about young people in Houston? What's happening here?
Well, we believe that there's a lot of young people that are vaping in Houston, but in particular, we've had 3 cases of young people who have been hospitalized and in the intensive care units as a result of a new and very mysterious as of yet pulmonary injury that young kids are getting from vaping. It's not just young kids, it's predominantly young kids. But an important part is that it's an injury to the lungs. It's not an infection. It's quite the mystery at this point.
So talk about what is the City of Houston's, your department, the Houston Health Department, what's the strategy for here?
So we coordinate closely with the hospitals as new cases come on, and this whole thing is relatively new across the United States. The CDC was the first one to sort of connect the dots, if you will, as these cases started popping up across the United States. We've now got 6 deaths related to this, all in different states, and it was really the CDC who started recognizing there was something going on. So we were alerted here locally in the state of Texas and in the Houston Health Department, and we started working with the hospitals to try and identify cases. That's how we identified these 3 cases. And so now we're trying to get the word out to warn people and educate them with what little we know at this point in order for them to be able to protect themselves.
You just mentioned what little we know, but from a medical and I guess scientific perspective, I mean, what's happening, or can you not give that answer yet?
Well, that's the mystery, right? So we know that all these cases, the patients are all having the same pathology as best that we can tell once they're hospitalized and the tests are done. We know that it is not an infection. It is an actual injury to the lungs. We don't know what it is in the vaping or about vaping that's causing it, but they're all related to vaping. There's a predominance of these cases towards young people. However, we've had people in their 20s and 30s who've been affected as well. And so there's the mystery. We don't know exactly what it is. And the other thing is that vaping is not brand new. Vaping isn't new in the last 6 months. So something has changed in the vaping world that is causing these injuries, and we're struggling to find out what it is.
Last question, and not sure if you know the answer or not, but compared to cigarettes, what are we looking at?
Well, there's lots of data on cigarettes going back decades, so we know just exactly how bad cigarettes are. There are those that say that vaping is safe. Well, no, clearly it's not. There's argument as to whether it may be less dangerous, but anyone who tells you that vaping is safe is not accurate. We know for a fact that it's not safe. And at this point, with this new illness, that completely changes the safety profile, if you will, of vaping. And right now, I would say it's at least as dangerous, if not more dangerous. We're not having people dying within weeks of taking their first cigarette smoke, right? So we do have that with vaping now. So something's definitely changed, and there's no way should anybody consider it safe.
Dr. Persse, thanks for coming on City Pulse. Really appreciate it.
My pleasure.
Thank you. So while the Houston Health Department is working to warn teens about the dangers of e-cigarettes, a new juvenile program is working to keep students out of jail.
Well, until I figure out who you are, you're going to sit with me now.
We're going to divert juveniles who commit crimes in schools in the 5th Ward to a community restorative justice program. So instead of perpetuate the pipeline from cradle to prison, we are putting our money where our mouth is. We're looking for action by cut to work with these kids to try and transform them into members of our society who are productive, who are educated, who want to help other people.
What we do need is transformation, aggressive transformation. Because if you see the need and you see the danger, then we have to intervene in their lives very, very soon. We don't need just to lock them up. We need to divert them, but we need to make sure as we divert them that we're putting them on a course that will uplift them. Our kids want to succeed, and we are no different than who they are. But for the grace and the support of others, I would not be standing here as your mayor. There are no bad kids. They're just kids that need more help. There are no throwaways. They are kids that are looking for guidance and direction. And there are no kids that cannot learn and cannot be enhanced, but they're going to challenge us to prove that we care. And if we convince them that we care, I promise you, they will rise and fulfill their God-given potential. That's the city I know. That's the city that we're trying to build. And it's starting right here with the Center for Urban Transformation.
So, can you commute? Can you drive the smart way? We'll tell you more after this break. We got more for everybody, you know what I'm saying? You know? Yeah, we got. What you drive?
Bentley.
Oh, man. Okay.
Vets, you served our country, and now you're home looking for a job. But how often have you applied and never heard back? That can be frustrating. That's why Edge for Vets was created, to open the world for you. The Houston Airport System and its business partners are hiring and offer this unique opportunity to get an edge in the interview process. To find out more, contact us at edgeforvets.org.
Sometimes the things we do or say can make others feel hurt, excluded, or isolated. Everything you say and do creates an impact.
How am I supposed to save the whole world?
You can't think about saving the world. You have to think about saving one person.
Because of you, someone's entire life can change. You don't have to be a superhero to have a positive impact.
Friends?
Friends.
Okay, I know you're sick and tired of traffic in Houston.
I'm tired of Houston traffic.
I know, gets on my nerves. So, Lucha Morales with City Savvy is here to show you how we all can be smarter commuters.
I don't know.
Sitting in traffic is not fun, but there are ways you can make your next commute to work, school, or home a smart one. Hey, I'm Lucha Morales, and this is Houston Happening. Houston commuters face busy roads and highways each day. That's why the city offers great alternatives to get around that cut down on traffic and time. Ready to roll? Sit back and leave the driving to Metro, the city's public transportation system. Metro gives riders a variety of options to get around, including buses, the light rail system, HOV lanes, MetroLift, and park and ride services. On average, more than 600,000 riders opt for a smart commute to work, home, or school each month. Next up is Houston B-Cycle, a bike rideshare system that launched in 2012. In 2017, some 50,000 riders traveled more than 900,000 miles and burned more than 38 million calories. Whether you want to take a ride around town or want a healthier commute to school or work, Houston B-Cycle can help you do both. If you're looking for a free way to travel in downtown, look no further than the Greenlink, a popular choice for those who live and work in downtown. Buses run every 7 to 10 minutes, depending on peak and off-peak traffic hours. Greenlink is made possible through a partnership between the Downtown District and Houston First, and operated by Metro. Well, I hope you make your next commute a smart one. Make sure you like and subscribe to our videos. Until next time, I'm Lucha Morales, and this is Houston Happenings.
Hey, thanks, Lucha. And by the way, Houston Happenings is a production of the city's Human Resources Department, and we're happy to share their stories. When we return, our furry friends take over the Houston Public Library. More after this. Dogs, cats, and I like both.
I'm a dog person.
You're a dog person.
I don't like cats.
You don't like?
No.
Oh, the cats are cool.
Whether you need a hand shopping for groceries, using up scraps, or finishing every bite, Meal Prep Mate can help you plan better and save more. Whether you're a newbie getting your first taste, a meal prepper honing your chops, or a meal prep pro hungry for a challenge, you can learn how to eat smarter, plan better, and save more at every step of meal prep. When you finish every bite, you save. Start prepping with Meal Prep Mate at SaveTheFood.com.
Houston,
where cultures come together.
Where inspiration
takes center stage.
And big dreams come true.
It's where fun happens every day.
Houston's a city on the move. It's a city that makes you groove.
That's the heartbeat. That's the rhythm of my town. Of my town. My town. My town.
Our town.
H-Town.
Houston is a city that inspires. Visit Houston for yourself and find out where the inspiration leads you.
Welcome back to City Pulse, your source for all the cool stuff happening with the city departments. How can reading be fun? Well, check out the story of how this pup is helping children read with confidence.
And the young kangaroo in her pouch said, "Me too. You're the biggest blamed fool in the jungle of Newell."
So today we had Read with Positive Pups. The idea of it is to encourage reading, and so kids that maybe aren't reading well still can read to the dog without feeling threatened at all, and just build confidence.
I have a passion for literacy, and I had decided a long time ago, because I met people, adults, that didn't know how to read or write, and I saw how frustrating it was. And then I realized that you really need to develop it as young as possible. I love being with my dogs, I love doing things with my dogs, and so I decided to train my dogs to be therapy dogs. Then I found out that there was the READ program where I could combine my love of literacy and my love of working with my dogs to help children.
Excellent. Very good. Anything that encourages reading, especially for my daughters, I've got 3 of them, 3 different reading levels, and anything that gets them excited about reading is definitely something that I'm going to come to.
All right, thank you so much for reading to baby. The reason we do it with the dogs is because there's a lot of anxiety in learning how to read. And so sometimes the dogs being there will reduce that anxiety because they're really there to read to the dog, not to me. I'm just there to help.
If you have to read a manual on how to work a book, a tablet, how to put something together, you have to be able to be familiar with operating the book, right? A tablet isn't always going to have the instructions, or you might not be able to find it online, but you can always pick up a book and read. And me personally, and all of my daughters are very tactical people. Being able to hold a book, touch a book, feel a book, see all of the different pages versus scrolling through things kind of gives it a little bit more of an interactive thing, and every kid likes to have an interactive experience. So from one parent to any other parent, it's definitely an opportunity to encourage, to come join, and it gets them out of the house. It gives them something to do.
That does it for this episode of City Pulse. I'm Trinell Thomas.
And I'm Ted Irving. We leave you today with words from Dr. David Persse with the Houston Health Department about the dangers of e-cigarettes and vaping, because this is a national story, so we have to hammer it home. So look, stay safe.
This is a real phenomenon. Parents, you need to look out for your kids, find out what they're doing, educate them that this is dangerous. Vaping is not cool. Cigarette smoking is not cool. And as a society, we need to stop making it look like it's cool, because it's getting our children to engage in behaviors that could have serious medical consequences for them later on in life.
City Pulse is sponsored by CN Vision Image Consulting, Chi, an international focus magazine. Music provided by Houston's own Dynamic Sound. HTV supports local businesses.